Sleep apnea machine is a machine that helps to treat one of the more serious medical conditions in which once you fall asleep, your brain doesn't allow you to continue breathing. It may be because of an obstruction in your throat. Your soft tissue relaxes when you sleep. And so the machine itself is just called a CPAP, or it might be called a BiPAP. CPAP stands for continuous positive airway pressure. BiPAP is just a bi-level, 2 levels of pressure that also help hold the airway open.
If you're sleeping at night and you open your mouth, we're going to want to put you in a full face option. That's going to cover both your nose and your mouth there. One of the most popular options we have right here, it's a ResMed product. So as you can see here, it's got the magnets for attachment. The really nice thing about this mask as well is it's got 4 points for adjustment. So you've got 2 up here that can kind of adjust the top portion, 2 down here for the bottom portion. This one really has some really good silicone seal on this one too to prevent leaks. It's got a very high pressure rating, which makes it really good for your basic CPAP or your BiPAP. So what you see here is one of our most popular nasal options. So if a patient walks into the store, usually the only way I set them up in a nasal option is if we know for a fact that when they sleep at night, their mouth is closed, right? So we don't want that mouth opening up when you have a nasal device on. So this is our most popular nasal one. Again, has the 2 magnets on the side there. Very convenient, easy to operate, easy to put on. There are those 2 adjustments at the top and 2 adjustments at the bottom for comfortability as well. I call this like a hybrid option. So this is going to go up under the nose and over the mouth right here. Sometimes when patients first start their treatment, sometimes when you get that full face over their nose like that, they can kind of get claustrophobic. Sometimes maybe it can cause some issues on their nose. This is a really good option for those people. It's very comfortable. Also really rated well for high pressure situations like in a bi-level or a high pressure CPAP machine. This is going to sit under the nose, so we would call this a nasal pillow option. This option is probably the best option we've had for being honestly very simple. It's you put it on, you put it over, not a lot of straps, very simplistic. Another good positive for this one too, people really seem to like this one. Instead of your hose coming out the front like this, it can kind of be a pain when you're rolling around at night. This gives you an option to have that tubing come out of the back like that. It kind of stays out of the way. People really enjoy that, so you don't have to be laying on your tubing every once in a while. But the biggest thing for a patient and when you're starting CPAP is to really get that good mask fit, okay? That's what we put a lot of our time into, and that's what's really important for people is to really find that right mask fit, because even though these are the most popular ones, they're not the best fit for everybody, right? So we want to make sure we individualize that and make sure we really find that right fit for them.